Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. A groundbreaking study spanning 326 rural Chinese villages and involving nearly 34,000 participants reveals that intensive blood pressure control can reduce dementia risk by 15%. The intervention included free medications, home monitoring, and personalized lifestyle coaching. While it remains unclear whether medication or lifestyle modifications drove the result, the broader implication is significant. Nearly half of all dementia cases could be preventable by addressing modifiable risk factors. Public health experts are now advocating for broader implementation of such interventions despite the need for further analysis of underlying drivers. Google's location history data is being repurposed to improve public health research. A recent study involving over 270 participants demonstrated how this data can map behaviors related to walking, exposure to pollution, food environments, and more. Unlike traditional GPS tracking, smartphone-based data is more scalable and less costly, offering a new avenue for behavioral health studies. Privacy remains a concern, but the use of anonymization and opt-in consent models offers a potential ethical framework for future applications. Research from UC Davis adds new clarity to the debate over respiratory health. Using breath samples to analyze oxalipins, key inflammation markers, scientists found that cigarette smoke induces significantly more airway inflammation than both vaping and marijuana. Vaping showed an intermediate inflammatory response, while marijuana produced minimal effects. These findings deepen our understanding of how different inhaled substances affect lung health and can help guide public health messaging and policy decisions. Children's Hospital Los Angeles has launched a nationwide pediatric sleep registry using the WiseHair app and the Apple Watch. This initiative collects over 30 million sleep data points per night, per patient. It offers a novel way to identify conditions such as sleep apnea and assess postoperative risk without requiring overnight hospital stays. As pediatric sleep care faces capacity limitations, this technology-driven approach aims to democratize access and improve early diagnosis. A toxin produced by certain strains of E. coli, called colibactin, has been linked to early-onset colorectal cancer. A comparative genetic analysis showed colibactin-associated mutations were more than 3 times as prevalent in tumors from patients under 40 compared to those over 70. The timing of exposure appears critical, with initial contact likely occurring before age 10. This discovery introduces a new microbial factor in the rising incidence of colorectal cancer among young adults. Researchers analyzing data from 10,000 patients are developing a precision mental health framework for depression treatment. The initiative evaluates how individual characteristics influence responses to 5 commonly used therapies. A new clinical decision support tool is underway to help clinicians match patients with the most effective treatments, reducing delays and improving long-term outcomes. This approach could mark a pivotal shift in managing the global burden of depression. Promising results from a UK trial show that oral immunotherapy can increase peanut tolerance in adults. Of the 21 participants, 14 were able to consume the equivalent of 5 peanuts after 9 months of treatment. Continued daily intake appears crucial to maintaining this tolerance. While larger studies are still needed, the findings provide new hope for adults with peanut allergies, traditionally considered a lifelong condition. A new study from Missouri is advancing our understanding of uterine development and disease. Researchers used cell signaling analysis to map uterine tissue formation and identify key biomarkers that may help detect endometrial diseases and cancer at earlier stages. These findings could support more accurate diagnoses, preserve fertility, and guide personalized treatment approaches for conditions like endometriosis and uterine cancer. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next